Hello, everyone. We'll just wait for a minute more and then we'll start the webinar. So I think we're good to go. So hello, everyone. Good afternoon, good evening, good morning, wherever you're based. I'm Deepti Beri from the George Institute for Global Health, based out of New Delhi office, and I would be moderating today's session with my colleague Gunjan Kakkar today. So I would like to welcome our distinguished speakers, colleagues, and the audience to this online seminar entitled Need for Transdisciplinary Systems Thinking to Address Snakebite. Thank you so much for joining in, and my special thanks to each one of you for sparing your time to attend this webinar on a Sunday. So moving on, and just to give a very brief background as to why we all are here today. So it is the 4th International Snakebite Awareness Day, which was first announced on the 19th of September 2018 by a coalition of various organizations. Celebration of this day aimed to give attention to a major public health crisis and raise awareness on the most neglected tropical disease, which carries a huge morbidity and mortality burden, and that is snakebite. We feel glad to be hosting this seminar today, as snakebite is a very complex issue and can't just be addressed if seen from a clinical care lens. Today in this seminar, we'll discuss how multidisciplinary approaches are needed to enable systems thinking for reducing the snakebite burden. We have expert speakers from varied fields who will discuss more in detail about these approaches and how together we can end the neglect. If you have any questions for our experts, please type in your questions in the Q&A box for ease of reading, and we'll try to answer them all. And if you are unable to do them, to answer them right now, we'll collate them and try to get back to you over email. So without much ado, let us begin the seminar with our first talk entitled Snakebite, a problem like no other, which I will be presenting. So here I just share my slides. Yes. So as you can see in the slide, snakebite carries a huge burden that approximately happens in 5.4 million people who are bitten by snakes across the world every year. And these are both venomous and non-venomous snakes. And as you can see here, there are nearly 2.4 million cases of envenoming which are witnessed in the world, leading to nearly 0.25 million cases of morbidity and permanent disabilities, like visual loss, depression, chronic ulcers, amputations, and with nearly 81,000 to 138,000 deaths, as highlighted in red, which you can see in the slide, according to, and these numbers I would like to point out is that according to consensus, these are highly underreported. As it is such public health problem that, as per WHO, one person dies due to snakebite every 4 minutes somewhere in the world. And if we talk about India, India witnesses about 50% of all global deaths due to snakebite, with a staggering figure of around 58,000 deaths each year, as per the recent estimates. So as we all know here is that snakebite is known as the disease of the poor, as it affects, it takes place mostly in the most impoverished communities of Africa, Asia and Latin America, and disproportionately affecting rural dwellers, agricultural workers, children, early adolescents, and displaced and people and tribal people, and mostly those who are living in poorly constructed housing. These are the people with limited access to education and healthcare, and who lack financial resources. As snakebite is a medical emergency, there is a positive association between case fatality rate and sequelae and delaying medical attention, which is very common in poor and rural regions. So and why is this so complex is that it's not just one reason for delay, but there are several reasons which can be due to distance, lack of transport, sheer ignorance, or trust on faith healers, and mistrust on healthcare workers and the health systems. As you can see from the map, there are quite a few regions where which have even more than 24 hours of delay time in seeking medical attention and the antivenom treatment after a snake bite. So as snakebite deaths and disability are considered highly underreported, the actual social and economic burden of snakebite also remains poorly studied and quantified. And as you all know, snakebite happens not just in humans, but also animals are bitten by snakes very often, especially in these communities. As humans continue to suffer socially and economically with deformities, with healthcare burden and increased out-of-pocket expenditure, animals too lose their lives to snakebite, which might hugely impact these communities which are dependent on animal husbandry. And we feel that with limited research on One Health, unfortunately, snakebite remains neglected in real terms. So, and if we talk about One Health approach to better health and environment, we feel the problem of snakebite doesn't end here, as killing snakes, which usually happens, is not the ultimate solution to reduce the snakebite burden. There is always a conflict between snakes and humans, where snakes are often killed on sight due to fear and panic and hatred. And though some of us might be aware and some of us not, that 85 to 90% of snakes are non-venomous. Snakes are the integral part of our ecosystem, and they play a very vital role in the food chain, both as predators and prey. Snakes also act as natural pest controllers, and they keep a check on the insect and rodent population. They are also known as the ecosystem engineers and facilitate in seed dispersal. They are the farmers' friends, as they feed on rodents and save tons of food grains which can be destroyed by these rodents. And declining snake population due to killing or maybe say trade or climate change and increased possibility of probability of natural disasters can lead to serious disequilibrium in the ecosystem. So why there is a need for transdisciplinary approach to dealing with snake bites, as that is not and as that is a problem. Snakebite is a problem, unlike many other non-communicable diseases, like which are very complicated, which is very complicated, and we cannot address the burden only when we view it from the treatment lens. There is a need to define this burden in a broader spectrum, and to understand its impact on both humans and animal health, and the socioeconomic burden around it, the health system's burden, and invest in measures to address it. We need to consider the role that snakes play and how the declining snake population can be controlled. Snakes are revered in various cultures of the world, and at the same time, they're also feared in various cultures. So it is important to understand the cultural aspects as well, which affect snakebite, and that can play a very important role in addressing the burden. It is also important to understand snake ecology, snake behavior, snake distribution, as these different disciplines related to snakebite, cannot work in isolation. That is why we chose this topic today of transdisciplinary approach to address the snakebite burden, as using systems thinking to bring all these disciplines together and initiate a conversation around it. Therefore, we have speakers from medical history, speakers talking from a herpetological lens, from a climate change lens, from the health systems lens, and I look forward to hear them in detail And before that, let us hear what respected Mr. Kofi Annan had to say about Snakebite.
A few years ago, during one of our frequent visits to Ghana, a local doctor drew my wife Nan's and my attention to the devastating impact that snake bites were having on the community. I was shocked to hear that snake bite kills between 81,000 and 138,000 people globally every year, with many more suffering lasting mental and physical impairments. By comparison, the mosquito-borne dengue fever claims roughly 20,000 lives annually worldwide. Snakebite is essentially a disease of the poor, mostly affecting populations living in some of the poorest, most rural communities of sub-Saharan Africa, Asia, Oceania, and Latin America. Small farmers, their families, herdsmen, and displaced people are particularly vulnerable. Despite its huge impact, snakebite is the biggest public health crisis you have likely never heard of. It never makes the headlines. To date, it has been largely overlooked. But it is also a challenge that can be solved. It should not remain a forgotten crisis, and we need to take immediate, robust, and sustained action. Affected countries, partners, and stakeholders have to mobilize adequate funding for public health systems and implement relevant policies and programs aimed at improving the prevention and effective treatment of snakebite. Owing to its leadership in global health issues, the World Health Organization must be adequately resourced to be able to tackle this crucial issue. Close collaboration with industry partners can ensure that safe and effective antivenom becomes available in all countries affected by snakebite and is affordable, including for the poorest and most vulnerable. By working together to tackle snakebite, we can save the lives of tens of thousands of our fellow human beings in some of the poorest and most marginalized regions of the world.
Thank you so much, everyone, for listening. And I'm very happy to introduce our next speaker, Dr. Rahul Bhaumik, from the Department of History, Women's College, University of Calcutta, West Bengal. Over to you, Dr. Bhaumik. I'm just stopping my screen.
Thank you for such a generous introduction. Let me share my screen. Is it visible?
Yes, Dr. Rahul.
Okay, before much ado, I start my presentation. My presentation is about the politics of authorization of snake bites in India. The protection and promotion of health and welfare in Global South are considered to be one of the most important functions of international health system during the late 20th and early 21st centuries. However, the ways in which present health promotion campaigns and prevention measures target marginal and less empowered social groups of the developing countries and try to police their health, sickness, and well-being somehow inform us how global health has closely entangled itself with the art of governing. Relying upon this understanding, I seek to address venomous snake bites in tropical countries like India as a specific site for understanding the politics of otherization, that is, identifying, defining, and categorizing an extrinsic injury as a neglected tropical disease or NTD. During the late 18th century, the systematic study of snakebite was first introduced in India. From the outset, the colonial scientific study of snakebite turned out to be a part of British Orientalist engagement with tropical nature and fauna. The problem of snakebite formed a significant part of British imagination of tropical wilderness, a cruel, chaotic, and disease-laden condition posing a threat to the life and health of the European colonizer. This idea of the tropics provided the European physicians an opportunity to construct a fundamental difference between Europe and India, intending that the temperate European landscape, climate, and constitutions were superior to those of snake-infested tropical India. 7 decades have passed since India became independent, but the venomous snake bites are still being essentially associated with the concept of rural, savage, and degraded tropics. During the past few decades, an overwhelming tendency to map snakebite within the topography of tropical condition is sorely evident in global medical academia. It becomes a shared practice among the international medical practitioners, policymakers, and stakeholders to characterize the problem of snakebite as marker of an environment that is essentially an quote-unquote other, unfamiliar in terms of its medical condition, economic order, and social structure. The tendency to promote snakebite as essentially a disease of the tropic is a part of a global discourse, one which specifically directed by the mandates of the World Health Organization. As a global guardian of health, this organization categorized snakebite as an A-list entity on 9 June 2017, giving it a high priority for large-scale action and research. But what is important to notice here is that the ways in which the World Health Organization-led global academia began to classify snakebite as an NTD, mainly affecting indigent and non-urban people living in some of the most underdeveloped areas in sub-Saharan Africa, Asia, Latin America, and Oceania. It is crucial to notice the ways in which the feature of being tropical is imposed on the disease of snake bites. This surely reinforces the representation of the tropics as a poverty-stricken, snakebite-laden, and an uninhabited other. There is no scientific basis in such disease classification by the WHO or by the World Health Organization, regardless of their so-called logical claim. It is increasingly evident that the scientific engagement with snakebite is closely associated with the global politics of othering, an underlying cultural process steered up by the World Health Organization's instruction to project snakebites as a disease of poverty, prevailing chiefly in tropical countries like India, where appropriate measures to detect, prevent, and control the disease are utterly limited or neglected. Identifying, categorizing, and terming snakebite as an entity is no doubt a hegemonic procedure which intend to encourage biomedical ascendancy over the tropics and its denizens who seem to be struck down by poverty-stricken and disease-laden condition of their own country. Thank you.
Thank you so much, Dr. Bhomik. It was very interesting to know about the whole conceptualization of snakebite as a disease of the tropics and the otherness of snakebite. So if there are any questions for Dr. Bhomik, you can please send them in the Q&A box. I see no questions for Dr. Bhomik, so we can move on to the next talk by Dr. Samadhi Bhomik. It is my extreme pleasure to introduce Dr. Samadhi Bhomik to the audience. He is a senior research fellow in the injury division at the George Institute, and he's also the co-head of the meta research and evidence synthesis unit at the George Institute. Over to you, Dr. Samadhi.
Hello, thank you, Dipti, for the introduction. We're starting the talk, and what I will be talking about today is about climate change, which is an imminent crisis which is facing our world, and how snakebite will be affected by it, and what can we do about it. As many of you might have already seen in the recent report which has come out just a few weeks back by the Intergovernmental Panel on Climate Change, there were various, like climate change will have various physical consequences. In the different models that the Intergovernmental Panel on Climate Change, or the IPCC, developed, all the future warming scenarios actually show that there will be an increase in temperature of more than 1.5 degrees centigrade, as well as there will be rise in the global mean sea levels. And what is actually more worrying is that even if we are able to remove the carbon from the atmosphere through various means in the next few decades, some of the climate change impacts, most notably the sea level rise, will not be reversed for at least several centuries. All these physical changes means there is quite a big impact on health. Extreme heat, rising sea levels, air pollution, deforestation, extreme weather events, and drought and crop failures are the consequences of the physical changes in the environment, which will lead to a host of changes in our health. This includes not only infectious diseases, which are quite well documented, but also non-communicable diseases and injuries, and also a lot of anthropogenic effects, as for example, like precipitating humanitarian crisis or leading to social changes which creates climate refugees. There's also a risk of food and water insecurity, malnutrition, hunger, and poverty. All these things mean the issue of climate change is quite complex. But what does it mean for snakebite, and how do we prepare for it, is something we must, as a part of the snakebite community, think about. To understand this a bit better, what we did is we first tried to understand what would be its impact on the burden of the climate change. So we started looking for studies which had already seen the impact by documenting it, or has modeled the impact of climate change or extreme weather events on any type of burden, whether be it incidence, prevalence, mortality, morbidity, socioeconomic burden, or any other things. And when we talk about these terms, we used it in a more broader sense so that we could be inclusive of the evidence that is available. So we searched for it in health as well as non-environmental databases. as well as some of the websites where we thought there might be some literature available in the available. And what we found is that there were just 8 studies. And the first group of studies which we found, 4 of them were on projected or modeled impact of climate change on the snakebite. Overall, this means that there will be a shift in snakebite risk to newer areas. From the very scant evidence which we have on these 4 studies, we know that this shift will be more northwards in North America, more southwards in South American continents, and we know from study notes that there will also be a southwards shift in that country. We also know that the climate change of about a 0.5 degrees centigrade increase in temperature in the next 25 to 30 years is expected to rise in snakebite risk incidence to about 31.3%. And these are predictions before this current year's IPCC, so the actual increase might be even quite high. And apart from these 4 studies which test the impact of climate change, because there are extreme weather events more expected, we also looked at what we know about it. And I would start with, again, there were just 3 studies with very scant evidence, and they mainly looked at correlation and association. And what we see now from the evidence is no statistically significant difference with tropical storms, hurricanes, droughts, but there was in one study from Israel, the heat waves, both during the cold and hot phase, there was a significant increase in the incidence of snakebite. This apart, there was also one study which looked at the effect of El Nino in Costa Rica, and it found that the peak monthly coincidence of snakebite coincided with them, and this was also related to not only increase in temperature but also high poverty index gap, how like living in destitute housing, and increase in rainfall. So all in all, even the climate variation would also start having some effect on snakebite. So this is what we know about it, but this also means it highlights quite a significant gap. From what we know that we don't know anything about several of the high burden nations of sub-Saharan Africa, India, Bangladesh, and Pakistan. Some of these countries are not only countries with high burden of snakebite, but they are also countries which, as per the physical changes, are known will be affected majorly by climate change, leading to a lot of social impact. So what does that mean for us is something we don't know. We also don't know anything about any other forms of burden, like how would climate change lead to changes in morbidity or socioeconomic burden or health systems burden. We just know about incidence and risk of snakebite. And what we actually don't know is that how anthropogenic factors like human migration, climate change, refugees, humanitarian crisis, these would also might lead to potential scenarios where people are living in dense environment, or like they are entering into and started living in areas which has traditionally not been inhabited by human beings, thus leading to increasing human conflict. So these models do not take into account many of these, and these are the things which can and should be taken into account in the future. Also, it might be that due to climate change, not only the distribution but also behavior of snakes might increase or decrease. We don't know that. And so it will affect it all good. So we need to know whether that would lead to an increase or decrease in snakebite. So this is what we don't know, but from what we already know, which is very minimal in nature and scant, and there's of course a need to do more. We also need to prepare ourselves. So because we know that there will shift in regions of snakebite, it's important for us to identify these newer areas and start acting on community-based interventions, because these are areas of communities who have never experienced snakebite. So there is a need for interventions around that. Also, if there are any changes in safe distribution and behavior, but even in areas which are currently seeing snake bites, there's need of community awareness, and of course there is this need for health systems adaptation plans, and some of it might be a bit relatively easy, though it's not around particularly bringing in antivenoms or putting in the infrastructure in place, but more complex and cultural things like making primary healthcare doctors to give antivenoms or the other aspects of the system so that are taken care of. They might be quite complex, and we need to start preparing for it. And we also need to develop climate resilient housing for vulnerable populations. So that is quite important. So this brings us to the question about what can global health actors do to address the effect of climate change on snakebite. There are three things. First of all, of course, is conducting transdisciplinary research, and this should involve not only what we do now, epidemiologists, climate scientists, and mathematical modelers, but also a host of other people, including herpetologists, ecologists, anthropologists, and agricultural scientists, as well as economics. And these things need to be funded through both the modeling as well as development of long-term cohort studies, because modelings are based on primary data, and we are as good as a model as what we feed into it. So there's a need to start doing long-term cohort studies, particularly in high-burden countries like in South Asia and Sub-Saharan Africa. And as a part of the global snakebite community, we also need to harness ourselves and be part of the global health system strengthening preparedness and resilience program, which will cross-cut across many diseases, but it's important for us to start having the conversation with this health systems actors. And yeah, that's all of my presentation, and the background research involving this work was supported by Deepti and Janu. So that's it. Thank you.
Thank you very much, Dr. Samadhi. Very interesting talk, and I guess it was very important information about what kind of climate change means for snakebite and what has been done already and what needs to be done. So thank you very much. I see no questions for Dr. Samadhi as well. Okay, so there is a question, Dr. Samadhi, for you, if you can address. So. Raj writes, we understand that the climate change, global warming leads to higher incidence of snake bites, but do we know why is it so, and what is the correlation between the two?
Yeah, I think that's quite an interesting question. So if we look at the global literature around what happens to snakes, we actually expect the population of snakes to decrease, and by correlation, you would expect the incidence of snakebite to decrease too. But there might be various factors associated with it, and that's just the knowledge gap. One of them might, of course, be the conflict might increase, though the numbers are decreasing, and the decrease in numbers of snakes would happen over time. There would be an interim phase when snakes are trying to adjust by moving, and hence the shift in the snakebite risk and entering of new areas. I think that's quite a thing for ecologists, environmental people, and people studying snakes needs to untangle. And of course, there's also how snake behavior changes apart from them moving. And also, not only the snake behavior, there's also human behavior as they impact the social crisis which climate change might trigger, including widespread migration. There is a chance that they will be, and the people who have not been involved with snakes are getting encountered and how they interact with them. So that also kind of brings in the lens of social scientists to fill in some gaps and understanding there. So what we probably would happen is there would be a substantial period of few decades where the risk will increase, mainly because changes or deaths. But it needs to be seen how what things would happen. And I would just like to add one more point that we really need to also preserve snakes, as I think Deepti was showing. Snakes play a critical role in the ecosystem, and they benefit us in a lot of ways. So we really need to work on that too, as we do it. We can't just hope that snakes die off, because that would have triggered a lot of biodiversity consequences, including malnutrition and hunger. So we really need to take those things into account. I hope I was able to answer the question. Thank you.
Thank you so much, Dr. Samideep. And so here I introduce our next speaker, Mr. Vishal Santra from Society for Nature Conservation, Research and Community Engagement, West Bengal. And he's also at the Captive and Field Herpetology, Wales, United Kingdom. Over to you, Mr. Vishal.
Thank you, Deepti. Can I share my screen?
Yes, please. Yes, please.
Yeah, so good afternoon, good morning to all the panelists, and also a very good morning and afternoon to all the participants. So what we are trying to showcase today at this very important meeting on a very important day, which is the International Snakebite Awareness Day, is to try and share an idea that we had been working on for the last 1.5 years. Before I go into the presentation, let me just give you an idea that snakebite and the problems related to snake bites are very local. Every region has its own character, own resources, limitations, species, behavior, anthropogenic activities. They all differ widely from region to region. So it's very important to understand the interaction between humans and snakes in a given landscape, and how and what can we understand about that interface. So what we did was we selected Hooghly district, a mainly agrarian district in West Bengal, to first standardize the rescue methodology. Rescue is a very commonly, very randomly used word, but there are differences when you try and define the word rescue and removal of venomous species. So we tried to standardize this methodology and then utilize the rescue data to understand the human-snake interface in agrarian ecosystems. Why did we plan this study? Because we needed to understand the interface between humans and snakes more properly, more intimately, so that we are able to design education tools and posters and outreach ways in which we can go into these communities to try and aware them about what's happening with snakebite and how things can be avoided, how snake bites can be avoided. So Hooghly district, it's primarily a lower Gangetic Delta, and it's entirely agrarian. So the entire population of this district are dependent on agriculture. And interestingly, if you look at the map, if you just look it up on Google as well, Hooghly district, you'll see that the villages are basically islands surrounded by agricultural land. So the village is always vulnerable to snakebite on all sides, because all sides are agricultural patches with water bodies, small rivulets and canals. Perfect tropical condition for some of the most venomous and frequently encountered snakes in India. So first, we needed to design the study based on certain data, which was mostly anecdotal. We do not know which species were biting, where they were biting, how many of them were biting, and what were the seasons when bites were happening. Now, the area that we selected for the study, there are 4 medically significant snakes: Vinaya naya, Vinaya tautia, Taboya russellii, and Bungarus cerodes. These are our 4 target species in this area who are responsible for bites that we know for sure. Now, the method was we trained 14 wildlife rescuers for a span of 1 year, and they were equipped They were thoroughly trained about safety protocols, and they were also trained to collect data at each rescue, because every single snake rescue was a data point. And we made sure that none of the rescuers were under the influence of any substance, or they were tired, or were not fit. We used EpiCollect 5, which is a freely available, brilliant app designed by the Oxford University. And one of the interesting things in this app is that you can collect GPS data. So this is the basic overview of the offline form that we have. We have all the rescuers' names listed on the app. They'll just have to select their own name when they're entering data for a particular rescue. Then comes date and time, and if it was rescued or not rescued, and if it was not rescued, was it visually ID'd, or it was not rescued and not visually ID'd. Then we have the list of all the snakes, the venomous as well as the non-venomous snakes that are commonly found in this particular study area. Then we have a very basic gradation of their age, adult, subadult, and juvenile. And then the most important part, the GPS coordinate for that particular rescue. And I would like to go back, and I just want to highlight one point. If you see on the right-hand side panel, there is a word called accuracy. So we always tell our rescuers to get the accuracy down to 10 meters, below 10 meters. That gives us a much more precise location of the occurrence of that particular species. Now we have broken up into habitats from where the snakes were rescued. Was it a courtyard, a bedroom, a bathroom, kitchen, a store, a shop, or a cowshed? So wherever the snakes are being encountered, we have that graded, and they select from where the snake has been rescued. If it was not a built-up environment where people live or keep cattle or store things, comes the agricultural field. And they can enter details like what was the crop, was there water, how much water, is what an active field or an inactive field, and where exactly in the field the snake was encountered. And they also have the option to take a photo and upload it with their observation. What we found was quite interesting. We are still trying to figure out why SOS for non-venomous snakes were much less compared to venomous snakes. There will be a little bit of bias. I'll not go into that details right now. But the point is, we have been doing a lot of outreach work in this particular study area. So could be that people were able to identify non-venomous snakes, so they did not bother to call us. They themselves just shoo it away or just let it go. But they were able to identify venomous snakes, and they called us. So you can see that we have almost like 50% extra of the venomous snakes that we have rescued from agrarian and human built-up environment. This is the seasonal graph of the snake activity spike. You can see that different species have different spikes. If you look at Daboia russellii, you'll see a spike in June, then it drops, then again you see a constant spike from September, and it almost remains the same till December. Why? Because Daboia russellii's breeding season is that September to December. Then again you see a spike for Daboia russellii in January, February. Why? Because the gravid females that are carrying babies will be basking very commonly, very, very frequently around bunds, around water bodies, around field edges. So that's why we see a spike. So the snake ecology, understanding snake ecology in a given habitat in terms of snake bite is very, very important. If we are to design posters for outreach, for education, either at community level or at school level, it is extremely important that we fine-tune our understanding of the species in that given area. This is the gradation of the time when most of the rescues have happened. We can see that early hours, there's very less, maybe because people are not up, they're not around, and they're not seeing snakes, but it starts growing after 6 o'clock in the morning. And it gets highest from 9 in the morning till 12 o'clock at night. So this is the time period when people are active, when people are seeing snakes, when people are encountering snakes. So this is how we are trying to understand the interface between humans and snakes in our study area. We are also collecting data on age group of venomous snakes, adults, subadults, and juveniles. Then coming to our final data that we want to share at this meeting today, we can see that 50%, even more than 50% of the snakes that we have rescued is from built up areas where people live, walk, sleep, keep cattle, store firewood. And if you look at the agricultural field, it's just 5.45%. So what we are trying to propose through this study and also trying to bring a different narrative to the understanding of snakebite in India, particularly in West Bengal, is it doesn't have to be necessarily an occupational hazard. We need to start looking at snakebite as a rural hazard. We also broken down the habitats from where we have rescued the medically significant venomous snakes in our study area. As you can see that it's still, again, goes beyond our understanding that the number of snakes that we are encountering within human habitations is staggering. It's really concerning. So we are taking Singur as an example from our study area. So Singur is a block. We have tried to develop a heat map, how and where people are more vulnerable to snakebite. And just zooming it on, if you look at the red patches, they are villages. And if you look around those red patches, the green patches, the brown patches, those are agricultural fields. So now you know how island type the villages are in our study area. And all the dots, the yellow, the blue, the green, and the white dots you see are all points from where snakes have been rescued. So you can see a conglomerate of snakes occurring within human habitations. So based on this, what we are trying to do is communicate data-driven facts about snake ecology, when, where, and how conflicts happen, understand that, and depending on those things, adjust rural living to coexist with snakes. Having said that, I would again like to stress the fact that every village, every community will come with its own character. It's very important to understand that we cannot have a universal tool for education. We'll have to adapt to local needs and requirements when it comes to outreach and education regarding how to prevent snake bites from happening in the first place. The second step of the study that we are trying to do is trying to integrate our rescue data with the hospital data from the same study area and see where we overlap, what we can extract from hospital data and what we can extract from our rescue data, and integrate them to understand where, when bites are happening. So again, coming back to the ecology aspect of snakebite, now we need to assess and predict seasonal envenomation and species in comparison to the anecdotal information that has been around for time immemorial. Much better chance of making the policymakers take an evidence. Much better chance of making the policymakers take an evidence-based decision on the way forward. This is very, very important. We would like to acknowledge all our wildlife rescuers. We'd also like to acknowledge the Infogram, which we have used to analyze some of the data and also to collect files. Thank you. If you have any questions, I'll take them.
Thank you very much, Mr. Vishal. Amazing talk, super interesting. It was really helpful to hear how you have been carrying out this project and using technology for data collection on snake species and distribution, the rescue work that you're doing, and awareness on mitigating snake-human conflict. Thank you so much. So in the interest of time, we can take the questions later if we have any. So it is now my great pleasure to introduce our next speakers, Professor Anthony Zui and Dr. Jagnoor.
Thanks, Deepti. I think I will go first, and I will also try and keep it short. I'm looking at the clock and seeing that we're running out of time. It's a hard act to follow after Mr. Vishal. As I was listening to Vishal, I was thinking, often research is seen as an acronym to action, and seeing research in action is really inspiring. So I hope we can change that model and do better as ourselves as researchers. So my memo for today was to talk about transdisciplinary research and approaches, and how, as an injury researcher, I see some commonalities with the challenges that snakebite as an issue has with others. So the one that I'm going to pick today is drowning, and drowning like snake bites also largely affects poor, rural, marginalized, and deprived populations of the society who have very little political voice and continue to be neglected. It is, in terms of distribution, it is higher amongst children. So it just adds another layer to the complexity. Another common thread, perhaps, is that both nearly cause around 50,000 deaths in India. When Bhaumik was talking about the trends, what is going to be the likely impact of climate change, and what would it really mean in terms of human-snake interaction and the issue itself, it is a similar struggle for the field of drowning as well, and there's a lot of limitation around that. And I'm wondering if what we see is a real change, or is it that we are just getting better at collecting a few things, or are we getting better at, or worse, at extrapolating things? So I think that's another common challenge. Complexity, as you reflected, Deepti, it's complicated and complex, and I wish things were simpler, but they aren't. And in the field of snake bites, we often talk about snake species, temperatures, and so on. Also patient response and how each component interacts, interconnects, and interrelates, and how all of that influences the ultimate outcome for a person or the victim. Both issues have rurality as a challenge, and the issue positioning overall in terms of differential exposure risk and the treatment. So a bigger challenge within the health system, but also what can we do better in terms of prevention. I think for both the issues, the outcomes also lie a lot within the science of society. It is about understanding better the context, the communities that we work in, the norms and the beliefs that happen once an event has happened. Once a snake bite has happened, once a drowning event has happened, how do people really respond? And I think one of our previous speakers was reflecting on awareness around that. And it is perhaps a little more than awareness. It's perhaps taking things to a different level with health promotion. And in terms of solutions, I think there's a lot to unpack. There's definitely a no-do gap, which I see is common between snake bites and drowning. There's a lot of research, there's a lot of known evidence. People like Bhaumik are interested and get excited about scientific evidence, but there's also colloquial evidence that is relevant to both the issues. And that colloquial evidence does make things challenging in terms of implementation. And I wonder what we can do over there. I would have switched on to Professor Zvi right now, but in the interest of time, I think I will go ahead and cover what I need to cover, and then I will switch to Professor Zvi. A lot of the second thing that I really wanted to cover in terms of what we can do to be better at transdisciplinary research has already been covered by Shamidi. However, one of the things that I hear a lot between these two issues is also there is no home. There's no home for drowning, and there's no home for snake bites. And I have started wondering if we overvalue home. Is it such a bad thing to be a nomad? Is it such a bad thing to have an Airbnb kind of a model? Is it really necessary to have walls and define boxes and be within those bubbles? Can't we take it as an opportunity that we do not have any bubbles? And I can see that it is challenging at times. Often when I talk to colleagues who work in snakebite field, I ask them, okay, so which conference are you excited about? And there's a long pause. They don't know which conference to go to because it's so dispersed. So I value the challenges, but I think it is equally an opportunity, and it comes along with how we can do better in terms of being multilingual, sharing, but also applying the knowledge across various disciplines. How can we break the barriers across various institutes, funding organizations, and even journals? I think transdisciplinary journals such as global health journals, planetary health, and just multidisciplinary and transdisciplinary journals there in their title are a great opportunity. So that is me for the moment. And now I would love to hear from Professor Z on how we think we can handle it in terms of policy. Thank you.
Okay, thank you very much. It's been a great opportunity to hear from people and about a range of different studies and approaches to snakebite. What I'd like to do is maybe just cover a quick range of issues that are worth thinking about. I want to first of all acknowledge that I'm on unceded Darug land in the northern part of Sydney in Australia, and the sort of backdrop to my picture is an artwork by Alice Price Petiare, which is called Yam Dreaming. So I wanted to just cover a few things, and I'm not going to go through all of these, but the speakers really raised a range of very important issues related to what was defined as otherization, like the neglect of certain areas, the links between snakebite and other extremely pressing concerns like climate change, and obviously the importance of technology and facilitating, using technology to facilitate understanding and control over issues. For me, I think the whole debate about multidisciplinarity and transdisciplinarity is seeking those multiplicative sort of insights. So it's more than just accommodating a range of different insights from different disciplinary perspectives and different viewpoints, to go much more deeply and much more widely into understanding an issue, which allows one to then think about some of the policy implications. Jagnu has already mentioned the importance of contextualization, and so have all the different speakers, that people have said, if you're looking at policy interventions, that context is everything, but it's more than just the backdrop. It's also how context relates to the range of possible policy options, who the actors and organizations are, and through what sort of processes they can get their issues to the table. I think the quote in the video from Kofi Annan really highlighted an important issue, which is the lack of knowledge and visibility of snakebite. And again, we've heard a range of reasons as to why that's the case. Policy is often driven by those who've got power and those who have got the ability to attract attention to the issues that they're concerned about. And this has been an ongoing struggle for something like snakebite, which a number of speakers have already said, affects people who are often seen as marginalized, the people that are poor, maybe they're people at the interface between a range of development activities and their communities, and both the governments and various funders will opt in favor of development activity rather than protecting poor communities. I think at this point, in terms of sort of understanding some of the policy implications and living through the global pandemic of COVID-19, there are a range of issues that get thrown up every day from which maybe we can draw a range of issues. One of them, which again people have really emphasized, is that these conditions affect people differently, differentially. So they often reflect inequities and inequalities. And the way in which responses to them are developed reflects who's got power and control. And one of the key areas that has become very apparent, but greatly neglected, is the power of communities, their voices, their organizations, and their ability to influence policy change. So there's some key issues there about recentering communities and people. And I think in relation to snakebite, that point has been made repeatedly, and it applies equally to drowning and a range of other neglected conditions that communities and people affected obviously want to see change being undertaken and responses to those conditions which affect them being taken forward. And we need to do much more to listen to those voices of communities and those who are often marginalized. Now, these sorts of issues have been raised much more generally in relation to COVID-19, and people have called to reclaim comprehensive public health. What are some of the underlying principles that we should be adopting in any of the things that we work on? And I think these are as important in relation to COVID-19 as to snakebite or drowning. Co-development, working with communities, with people who are affected, understanding that people have agency, people at local level can do things, and one should be supporting, we as academics, researchers, policymakers should be supporting people on the ground. We should be recognizing the diverse knowledges that, again, Jagnur and Shumadeep and others have referred to, traditional knowledge, cultural knowledge, local insights, as well as scientific knowledge, really ensuring that there are opportunities for meaningful engagement, for people to engage actively and to influence multi-sectoral responses, because there's no single response to these important but neglected conditions. And long-term, we need to keep in mind that these reflect power and other inequalities, which really need to be transformed and addressed if sustainable solutions are to be found. And I wanted to end with a quote from actually one of my students, who says that academic research is activism. So if we're researching issues, if we're focusing on issues, if we're looking for solutions, it's not just about sort of excavating and assessing what has been done, what has already occurred, but we should be sort of seeking to define new ground, to open out areas where new conversations and debates can be put on the table, and transformative solutions, innovative solutions can be sought. And that requires learning from the ground. And I think in all these examples that we've heard today, it is very much about learning from the ground and building up from there rather than top-down approaches. So thanks very much.
Thank you so much, Professor Zui and Dr. Jagnur. Thank you everyone for listening, and I hope you found this seminar interesting and helpful. Thank you very much again, and have a good day.
Thank you, everybody.
Thank you.
Thank you.
Thank you. It went really well, and each one of you did amazing, and it was really good to hear so many different perspectives. Well done.
Thank you so much. Bye, everyone.
Bye.
Thank you, everyone.